Hello and welcome to our webinar, where today we'll be discussing Are Brain Aneurysms Hereditary? September is Brain Aneurysm Awareness Month and also our first birthday, so we're taking time to talk and share experiences about this critical condition. It's a question we hear a lot on the Facebook communities and through our own channels too, so it feels only right that we tackle this and hopefully share some valuable experiences and useful information along the way. Joining us today is Professor Julian Barwell, Consultant Clinical Geneticist at Leicester University Hospital Trust and Honorary Professor in Genomic Medicine. He's also the Academic Champion in Clinical Genetics at the University of Leicester, author of several research papers, and most recently author of a children's book called What is DNA? A book to help older children understand DNA and how it works inside our bodies, and available to pre-order soon. Thank you for joining us. Also today joining us is Dawn Roberts, a member of HBA Support's patient panel. Dawn is an optometrist from West Yorkshire who had a brain aneurysm that was screened for because of a strong family history, and we'll learn more about that later. Thank you very much for joining us today. So let's get straight to it. Are brain aneurysms hereditary, or in other words, do they run in families? And is this because of genetics, the genes that we pass on through the family lines, or is it down to bad luck? Dawn, perhaps we can start with you. Would you be kind enough to share your story, please, of your diagnosis?
Yeah, so the first time I really knew about brain aneurysms was when my brother was diagnosed with one in June 2017. And unlike me, he has decided he's not going to do anything about his. Apparently his is very large, but he was told that surgery carried a lot of risk for him. Then in February 2022, my daughter had a subarachnoid hemorrhage. Originally, the paramedics thought that she had meningitis. And I actually thought at the time that it was a ruptured brain aneurysm, knowing that my brother Mark had one. So when we got to hospital and she'd had scans, I was told that she'd had a bleed on the brain. And the hospital we went to, Pinderfields in Wakefield, isn't really a centre of excellence for this sort of thing. And they contacted the Leeds General Infirmary. And the specialist wanted to speak to me on the phone from the Leeds General Infirmary. And he asked me whether anyone else in our family had ever had a brain aneurysm. So I told him about my brother. And he said to me that in that case, I should be scanned. And I asked him, well, should my son be also scanned? And he said, well, not until you are. Let's find out whether you've got one first. And then if you've got one, we'll have to have a look at your son as well. Carmel has gone on to make a more or less full recovery from her terrible experience. She was in hospital for 2 weeks. She's lost a little bit of short-term memory, so she writes everything in her diary now. But other than that, she's absolutely fine. So I eventually managed to be screened myself. I was called by the GP to say that the results of the screening were back and that I had what looked to be an 8 or 9 millimeter saccular aneurysm at the base of the tip. And I said, what does all that mean then? Where's the base of the tip? And what are you telling me here? Is this, do I need surgery? What is it? And he actually said to me, well, I've forgotten all my brain anatomy. I can't tell you where the base of the tip is. I can look it up if you like, but you can look it up on the internet yourself, which I thought was really a useful comment to make. Then he said that he would refer me to the Leeds General Infirmary, to the neuro team, and that I would probably need surgery. As it was, I knew by then that the waiting list is very long. And I was actually told that I could be waiting up to 2 years to have the surgery. So I've got private health cover with the company I work for. And so I went privately, but it still took 3 months to get the surgery, even after that. And knowing I've got one, we then asked whether my son should be scanned now. This was August last year, just over 12 months ago. And they told us, yes, he should be scanned. And actually, he's having his scan tomorrow. It's taken so long for him to actually be scanned. So we're waiting and hoping that he doesn't have one.
Thank you for sharing your story, and it's quite a journey, and I'm so glad that you're okay now after your surgery and your daughter is doing well after her hemorrhage, and what a journey she's been on too. Julian, Dawn's journey really does point to a family cluster there, a pattern in that family, and possibly a hereditary pattern and genetic link. Could you share more about what we know about this condition and why it clusters in families and what that all means?
Thank you. Yes, it's a really difficult when you get a cluster like that in the family, because firstly, you wonder is how many people have actually got an aneurysm, and also whether or not there's any challenges in trying to arrange screening or treatment. And it's not only a practical decision, but also a major psychological concern for families about have genes been involved, whether or not these aneurysms could burst and cause a subarachnoid hemorrhage, and what could be the lasting impacts. So I'm sorry to hear that, Dawn, but really encouraged to hear that your family has been able to access support, screening, and care, and that your daughter's on the mend. And best of luck for your son. To try and work out if there is a coincidence or a genetic susceptibility is difficult. There's three fundamental ways in which it's done. So the first is looking at twins, identical and non-identical twins, when you look at a condition, and see if there's a difference in people who've got the same genes, which are the identical twins, which come from a single fertilized egg, or is there a different amount of aneurysms when you've got what we call dizygotic twins, which are very similar genetically to siblings, which are two eggs and two sperm that join together. So that's the first classical approach to trying to work out if a condition is inherited. The second one is to look at clusters in families such as Dawn, to see if you've got somebody who's got an aneurysm, ask their parents, the siblings or the children have got something similar. And obviously that depends on whether or not we've got very good data about how common aneurysms are. Because actually we're not really quite sure how many people in the general population go around with small aneurysms like this without causing any symptoms. And then, of course, how often they are then to rupture. The third way is when you find a person who's got an aneurysm is actually to then do what you might call case finding, which is to plan to look at people with aneurysms and then actually to do screening on all of their relatives, and to do something similar for people who don't have a family history as well, and do direct comparisons moving forward, and then see what happens to people with the aneurysms and those that don't. And to do alongside that genetic testing, where you look to see if you can find a difference in the genes, and we've got 20,000 we get from our mum and dad. And you can either look at what we call agnostically, which means you look at all 20,000 genes, or you might look at what are called candidate genes. So this is looking in areas where you think you might find something. And this is classically what we do. And so there are some conditions which we know are associated with an increased risk of aneurysms alongside other problems. So the classic one is something called polycystic kidney disease. Now, in that condition, people, as they go through adulthood, tend to develop lots of cysts in their kidneys, and that can lead to an increased risk of bleeding through the urine, or protein loss through the urine, and affect kidney function. But there's an increased risk of these brain aneurysms. But it can be associated with other conditions, associated, for instance, with hyperflexibility. So things like Ehlers-Danlos syndrome and Marfan syndrome. So often what the doctor will say is if there's polycystic kidney disease, if there's Ehlers-Danlos or Marfan's, and if you've got a family history of aneurysms, then definitely we'll go screening. Or if you've got lots of relatives with aneurysms, we'll go screening. The challenge is, what do you do when you've got a single relative with an aneurysm? So that's sort of challenge number one, is how do you anticipate if there is a likely to be a gene change in the family, and if screening is going to be helpful. But then, of course, the second thing is, when you screen, what are you going to do about it when you find something? But we are learning all the time, and there's lots of new genes which seem to have an impact on aneurysm risk. But those big ones are if you've got lots of affected relatives, if there's a connective tissue, this extensibility issue, or polycystic kidney disease. And those are the three main challenges that we come up against.
And I believe as well, Julian, that twin study that you referred to also indicates and points to the fact that this is a hereditary condition, because both twins were found to kind of carry an aneurysm. So it was pointing to genetics there as well.
Absolutely.
So yes, absolutely. There are other conditions as well that mean that you are at a greater risk of brain aneurysms. But where those conditions aren't present, such as in my family, then when the clusters are there, then there is still a flag that needs to be investigated and to go to kind of GPs to look into that further. And I suppose that takes us on to our next point about diagnosis and screening, and how we make choices to go looking for a potential diagnosis. Dawn, if we could come back to your experience, please. Could you share your experience of screening and how you had some very difficult conversations with your family about what to do next once you were presented with the information that this condition could be hereditary?
Yeah, so to get my own screening, naively, although I do work in the NHS, I expected to be offered screening fairly quickly after what had happened to Carmel. I thought, I've got this thing in my head that could do the same to me as it did to her. And I had been told that because of where mine was, my chances of survival were much lower than hers had been if it had ruptured. And after 2 months, I hadn't heard anything at all. So I got in touch with my GP, and he arranged for me to be screened then at the Bradford Royal Infirmary. And that happened quite quickly then, within about 10 days. Then they said to me that I should hear within a fortnight. My GP would get the results definitely within a fortnight. After 3 weeks, I still hadn't heard anything. So I had to ring the surgery, and then they rang me back very quickly to give me the results and say they were very sorry they'd got these results. They didn't realise nobody had called me. So I didn't feel that was particularly great. And it was a shock to find out that I also had one. We didn't know whether my parents had ever had anything like this. Both of them, unfortunately, are no longer with us, so we couldn't ask them. So after I was screened, as I say, I went privately for the surgery, and it still took 3 months. I then had the conversation with my son, who is my only other child. He was unsure, really, about whether he wanted to be screened, because the difficulty is you have to be prepared, if you're going to be screened, to be told that, yes, you've got one, but they're not going to operate on it, that it's just going to be watch and wait, or that it's in a position where surgery might not be successful, or there are more risks with the surgery than there are leaving it alone, which is the situation that my brother is in. And he took a couple of days to come around to the idea that, well, look what had happened to Carmel, and he didn't want that to happen to him. And I've said to him several times over the year while he's been waiting, you don't have to be screened if you don't want to. If you don't think you can live with it, if they say you've got one, but they're not going to operate on it, then, you need to decide what you're going to do. In the meantime, we also spoke to my niece, my brother's daughter, who has 2 children. And she has decided she doesn't want to know. She isn't going to be screened, and she's just going to live with it, knowing that there's probably a huge proportion of people in the country who've got an aneurysm in their brain and don't know, and it never causes them any problems. So my experience of the actual screening was fine. Getting the results wasn't brilliant. It was never a doubt for me that I wanted to be screened. I'm one of those people who always wants to know if there is something, and then you know what you're dealing with. But for some people, that might not be the way that they want to go. That might not be an option for them. And it's a real difficult situation for them if they feel that they wouldn't be able to cope with knowing they've got an aneurysm in their brain, but that there's not going to be any treatment other than watch and wait.
Yeah, absolutely. I suppose speaking from my family experience as well, I've had relatives who have had screening, been through screening, and also relatives who would prefer not to know. And there's no right or wrong decision, is there? It has to be a very personal choice. My diagnosis came from a realization that both my grandmother and my mum died of ruptured brain aneurysms. So we lost them both very early. My grandmother in her 30s and my mum in her 50s. And very much like you, I had to fight for my screening. I started my journey again, as you, was a GP surgery, and I was diagnosed in my 30s. And then it was only when I turned 40 that I was on that watch and wait sort of regime that we found that my aneurysm had grown, and it was time for me to have treatment, and that included 3 coils and a stent. But luckily, right at the start of my journey as well, my GP referred me to a genetic counsellor, and this is where I first met Julian and his team, and I had the opportunity to be part of the 100,000 Genomes project, which is a research project looking to diagnose and research rare disease and rare cancers too. I joined that program back in 2015. My blood was taken in December that year. And I live in hope that one day my DNA, that is now part of the National Genomics Research Library, will unlock or at least throw some light on the genetic foundation of the condition. Moving on to who should be screened then. So NHS guidelines say that screening is recommended for people who have had 2 or more first-degree relatives. So that's a mother, a father or a sister, or a brother as first degree who have experienced a brain aneurysm or had a hemorrhage. But we also understand that many times, consultants use their initiative and realise that if families perhaps don't follow that, but they still have a very strong cluster in their family, that it's still worth the investigation, which is also worth knowing. Julian, if people do suspect that they do have a cluster in their family, that there is a pattern there, what should they do? Should it be to start with your GP? And are they looking for a referral to a neurosurgeon, a genetic counsellor, both? And how can genetic counsellors support and help patients and families through this kind of diagnostic and screening journey?
Right. Okay. Thank you. So the first point is that we have a universal triage system or way of thinking about family history and action. And it's what I call the old Ted Rogers and Dusty Bin 3-2-1. You're too young to remember Ted Rogers and Dusty Bin, I'm sure. But before Simon Carroll came along, there was, I'll try not to get it wrong, 3-2-1. And rather than win a prize, we think of it as 3 relatives, 2 generations, 1 under 50. And if you've got 2 of those in your family, so you did, for instance, you had 2 generations because you had a mother and a grandmother, and you had one of them, your grandmother, was diagnosed under 50. So as soon as you've got that is a red flag. And that's the same if you're dealing with breast cancer or pulmonary fibrosis, whatever it is. If you've got 2 out of that 3-2-1, you should be starting to think, do I need to go and speak to my GP about this? Could this be an inherited trait which is going to need some sort of action? So yes, we talk about 2 first-degree relatives, but of course, not everyone's got large families. So if you're if it's your mother and your grandmother, that to me is still significant, and that's a first and a second degree relative. It doesn't necessarily need to be your mother and your daughter, or your brother and your daughter. It could be mother and grandmother, or brother and your brother's child. That would still be significant to me, particularly if one of them's under 50. So yes, you speak to your GP and say you're worried about your family history. Now, if you don't have symptoms, headaches or some neurological problem, the first point of call should be really clinical genetics, and that would be to confirm the family history, to make sure we're talking about 2 or more people with the same condition, and to see if any genetic testing would be possible, and to see if we're looking at one of the so-called, what we call syndromic causes, like the connective tissue, the Marfan's type problem, or a polycystic kidney disease. So has anybody, for instance, had a kidney scan in the family? So would be where I would start. And at that point, you would then start that debate about whether or not screening is going to be helpful. And I think Dawn's point about whether or not you'll be comfortable to know that it might be a watchful wait to see if it's growing, which obviously what happened to you, Rebecca, but also that maybe that actually surgery on balance may be more risky than actually just sitting tight. But it would be wrong to say that surgery is the only thing that might help. We may be able to give advice about smoking. We may be able to give advice, for instance, about blood pressure management. And certainly blood pressure management would be something we'd be really keen to talk to patients about, and keep their blood pressure at the lower end of normal rather than bouncing at over 140 over 90. We'd be wanting to get it significantly lower than that for people who have got these types of aneurysms. But psychologically, how you feel about screening, or how you feel about living with knowing that you have an aneurysm, is incredibly important before you go into that MRI scanner. So having that joint discussion with genetic counselling and then neuroimaging and neurosurgery about what you would do when you get that result is so important. And health behaviour. Some people, like Dawn, like to know what they're facing. Other people are feeling a little bit more worried about, living with a time bomb. And so I think it's really important to have that conversation up front with the genetic counsellor, so you know what the potential pros and cons might be. But certainly if you fit that 3-2-1 rule and you're highly motivated to know what it is that you're facing, and you're potentially comfortable to have those discussions about treatment or watchful waiting, then certainly in these contexts, because aneurysms are really rather common, then a lot of patients will benefit from that screening.
Thank you, Julian. That's really interesting points. And there is no right or wrong. It's working with a genetic counsellor and having those tough conversations with yourself, as you say, before you go into the screening, because once you know, you can never unknow as well. And that's a really important consideration as well. Well, here we are today. It's Brain Aneurysm Awareness Month coming up in September. And Brain Aneurysm Awareness Month is all about raising awareness of the condition. But what's your experience, I'm wondering, about the hereditary condition? How well known do you think it is? What do you think should happen to increase awareness? Julian, perhaps if we could start with you. What do you think what are the challenges of raising awareness of this condition in the clinical setting? Perhaps how well known do you think it is with your clinical colleagues?
Not at all well known. You've obviously got a lot of context. So you've got general practice, you've got A&E, you've got neurosurgery, neuroimaging, and clinical genetics. Now, certainly in neuroimaging, neurosurgery, and clinical genetics, there will be some understanding of that. But in primary care, there will certainly be less so. And it's not something that's classically taught at medical school. And certainly there's big concern about, well, what are you going to do if you find that you've got that aneurysm? So I think there's really at least two campaigns which need to be considered. One is, once you've actually ascertained that someone's got an aneurysm, to ask the question about family history and whether somebody would want to find out if they've got the aneurysm. But the second one, crucially, is about that ownership. It's one thing to take a family history, but it's a whole other thing to then actually then make sure the patient can have that follow-on discussion with neurosurgery, with neuroradiology. Many times we end up, or in the past at least, we saw families where 6 or 7 people were affected with a condition before actually anybody was even referred into genetics. So this is part of the 3-2-1 rule. We want people to ascertain whether or not people have got 2 of the 3-2-1, but then make the referral if the patient is keen to look into it. So it's an attitude thing, but it's an ownership thing as well. And of course, a big part of that is training. So what I would do is, you need to show the benefit of screening, because that will get people on side, and tell stories like your story, Rebecca, is really important. Add to the clinical research literature about the benefits of screening and that the hereditary nature, but then get that teaching into postgraduate education courses. So these are the up and coming GPs, radiologists and neurosurgeons and geneticists, but in time to get it into medical school curriculum. But of course, medical school curriculum, that will take 10 years to start to come through to clinical practice. If you do it to postgraduates, you get it immediately into practice. So it's partly about storytelling, it's partly about research, it's partly about teaching, but it needs to be outcome focused, and there needs to be an ownership focus.
Really, really good ideas, and we are busy at Hereditary Brain Aneurysm Support talking to organisations such as Medics for Rare, who are exactly doing that, teaching new up-and-coming doctors at every level about rare disease, and we're trying to get hereditary brain aneurysms on that map as well, so we can raise awareness early, as well as working with the existing clinical community as well. Dawn, if we can come to you, what about your experience of this condition when you spoke to different friendship groups and also within your family and your GP? How well known or not did you think that the hereditary condition was? Did you have to educate as you went along?
I don't think even there's a great awareness of brain aneurysms of any kind at all, even ones that are found incidentally due to being scanned for other things. But certainly almost everyone that I've spoken to has been shocked that Carmel at 28 had her brain hemorrhage. They thought that was an isolated thing. And then to find out that I also had a larger aneurysm than she had. Many people have said to me, I had no idea it could run in families. It's what colloquially we say, isn't it, that things run in families. And even as an optometrist, obviously, when I was training at university, we do quite a lot about the brain and the way the brain works. I've spoken to other optometrist colleagues who also are not really aware about brain aneurysms and what they actually are, let alone that they can be hereditary. So I think there's a very low awareness within the general public about them. And then I'm a member of a Facebook group that's called Brain Aneurysm Awareness UK. And on there, everybody who's a member of that either has got one themselves, has had it treated, is on watch and wait, or is a member of a family of someone who has got one and wants support about that. And there are people on there who really don't realise that it can run in families, and that they will have a relative in the past who has sadly died from a ruptured brain aneurysm. They find out that they've got one as well, but they still don't think that their children might have inherited it too, or that their brothers and sisters might have. So I think there needs to be a lot more awareness about the fact that there is or can be an hereditary nature to having a brain aneurysm.
So a lot more for us to do through September, Brain Aneurysm Awareness Month, but also going forward as well. And I think you're both right. Sharing patient stories is so key to kind of bringing this condition to life as well, and also supporting different families within our communities as well. As we draw our webinar to a close, I think it's right that we throw a spotlight on the research that is happening right now. We've talked about the genetics of this and how it is hereditary, but what we haven't found yet is the genes involved, that genetic foundation. As we saw from our own research, which we published last year in our targeted literature review, research is ongoing. Our literature review looked at 37 studies that looked specifically at familial brain aneurysms, and these studies took place across North America and Europe and Asia too, so globally. 80% of these provided evidence to implicate several genetic variants that could play a role, and of these 6 came up more than once. And these genes were involved in how our bodies develop and maintain the integrity of our blood vessels in the brain. So promising, certainly in the right area, but more research needed. The Heart and Stroke Foundation in Canada is supporting research in this area, and recently we became aware of a couple of European interesting studies looking at risk predictions in people with a strong family history, and we'll put all of these links on our website very soon. So absolutely good news that there is research happening right now, but we're not there yet. There are a few genes that we suspect, and we know environmental factors, Julian, you pointed about high blood pressure, and other environmental factors such as smoking do play a risk as well. So there is research, and we are finding out more and more each day, but not quite there yet. So I suppose, Julian, the $64,000 question is, when do you think we'll get an answer? When do you think we'll go, aha, that's the gene, all the genes involved in this condition?
Well, it's a numbers game, really. So what is required is collaboration. It's quite rare to see very big clusters in family where you've got five or more people affected, but we need as many of those types of families to come forward, and we need to link different families throughout the world into different types of aneurysms, looks at the other risk factors associated with them, and look for the common genetic changes that are within those databases, but also then look in people who don't have aneurysms and see if they also have variants in that gene, those genes as well. So we'll probably find that this isn't one condition. We'll probably find that there's, I suspect, 30 or 40 different genes which have an impact. And what it will be interesting to find out is this a simple one single gene causes a condition, or a bit like height, actually, is it a combination effect of blood pressure and small impact of a number of different genes all factoring in together to run into a problem for an individual? So I don't think there's going to be a single gene which will sweep up large numbers of families. What I suspect is we'll find lots of genes, some of which may be specific to individual families, but I think we'll find lots of genes involved, but also a cumulative effect of genes. So I think it is going to take a while, but I think it does depend on how quickly we can get organized in bringing families together using approaches like the Genomic Research Library, which is fantastic because not only can you look at people who have had aneurysms, when you then find a candidate gene, you can then compare it to other people as well. So that sort of databasing is definitely the way forward, plus picking up these large families as well. Now, looking at Dawn's family, for instance, classic 3-2-1, she's got herself, her brother, and her daughter affected. But of course, it only came to light because one person had a very difficult episode, but other people came forward for screening. So I think the message has to be, yes, it can run in families, but also we need those relatives to access services find their aneurysms because there's probably lots of familial aneurysms that are just not being detected. So I think if people are comfortable, it's to access services, then come back to genetics and say, look at our family. Can we start to take part in these studies so we can help that search for these new genes as well, if people feel comfortable to do so and if timing feels right for them. But obviously, anybody with an aneurysm under 50, but particularly under 30 in Dawn's daughter's examples, is think, gosh, could there be an inherited trait here? And as a family, are we keen to look into that from a screening and then potentially from a genetic perspective? How long before we get it all sewn up? It's going to take years. I don't think this is going to be 1 or 2 or even 5 years, actually. I think, because people normally say, 5 years, it'll be sewn up. I reckon we'll make really good progress in 10, but I wouldn't say it'll be sewn up till 20 because it's quite rare. And we're not routinely screening people with a family history yet, because we don't even know they've got a family history, because we're not asking that question and we're not getting people to come forward. So I think the first step is to get more people to come forward, to have that screening when someone's affected, and then to re-engage them in genetic studies and to get coordinated internationally.
Thank you, Julian. Absolutely. It's ultimately a numbers game, isn't it, that we have to try and put some numbers around this, the prevalence, the incidence, and how common is this rare disease. We may actually find it's not rare at all. So there is so much to do, and that is why we are here at Hereditary Brain Aneurysm Support, to try and increase that awareness, but also play our part in research and try and encourage more research and connect up with families as well. So we have to draw our webinar to a close. Thank you so much, Dawn and Julian, for your time today. We very much appreciate you sharing your knowledge and sharing your experience. We hope this will be the first webinar of a series. So please, yes, join us again on another day where we'll pick another topic. And thank you for joining us at home too. We hope it's helped to answer some questions you may have. Please take a look at our website for more information about the condition, including our new guides kindly written for us by our volunteer genetic counsellors. Our guide topics are on how to talk to your family about the condition, something that Dawn has touched upon today, the science behind the condition, again something that Julian has picked upon today, and also about what a genetic counsellor does, again something we've learnt about today, and the critical role they can play. So also a quick shout out to Bethany, Izzy and Saren, who put those together for us. And please take a look at our social channels too, addresses coming up at the end, where we regularly share information and advice. You can also post your own questions and thoughts there too, and we'll also post the links to those pieces of research that we referenced. Thank you again for helping us to mark Brain Aneurysm Awareness Month, and we hope together we can raise further awareness of this critical condition that has impacted my family, perhaps yours, and thousands of families in the UK and beyond. Thank you for joining us. Thank you, Julian. Thank you, Dawn.